Strategic Plan for Quality Improvement, Ebony Jolly, RN, Capella University. Quality healthcare is safe, effective, patient-centered, timely, efficient, and equitable. Establishing quality care standards necessitates effective leadership and collective endeavors from all involved in the planning and implementation process. The nurse's perception of their own self-confidence directly affects the quality outcomes of terminally ill patients. This hospital's acute care nurses report apprehension with managing symptoms of terminally ill patients. Improving symptom management in this vulnerable population improves effective patient outcomes and the quality of care the organization provides overall. This presentation proposes an initiative to incorporate end-of-life concepts into professional development activities to improve the quality of care for terminally ill patients and a strategic plan for successful implementation. In healthcare, quality improvement is action-driven, evidence-based, and patient-centered. Improving practices aimed at managing the discomforting symptoms patients experience in the terminal phase of illness improves the quality of care we provide and patient outcomes overall. Changes made in the professional development of nurses enables forward progress toward the mission of providing the highest quality of care across the lifespan and success amongst competitors. Collaboration is vital to effective implementation. According to Lewin's model, change transpires in reaction to the actions of its effectors. Effective model application depends on the fluidity of interactions amongst members of multiple systems throughout the organization. Unfreezing actions have enabled the identification of this gap in service quality as the inspiration for change. The moving phase begins with your compliance and cooperation with the proposed actions, and refreezing will be demonstrated with the inclusion of newly gained information and skills into professional practices at the bedside as appropriate. Internal stakeholders with fiscal, legal, and ethical interests include the organization's nurse leaders, nurse educators, unit-level staff, and members of other disciplines. External stakeholders with physical and psychosocial interests include patients and their advocates. Communication, collaboration, empathy, and patience amongst both groups will be essential as impacts to each interest will present throughout the change process and interruption in unit activities will occur. Quality improvement in healthcare is a continuous and systematic process. Advantages of the proposed change include the realization of organizational and interprofessional success, as well as improvements in the overall quality of care provided. Improved practices aimed at managing distressful symptoms can be adjusted to transcend across care settings throughout the organization. A collaborative approach involving all stakeholders using a reliable change model is imperative to successful adoption. Professional development enables awareness of changes in healthcare delivery post-formal scholarship and thus improves the nurse's response to the specialized needs of patients near the end of life. Consequences for dismissing the proposed change include barriers to quality improvement, support for outdated practices, and a reputation of inferiority amongst members of the target community and competition. Leadership plays a significant role in the change process as it ensures change alignment with organizational goals, shapes the practice setting, and influences staff compliance. Leaders must be self-aware as transformational behaviors and emotional intelligence are vital to effectiveness. Nursing leadership support for collaborative and evidence-based behaviors will facilitate program development, implementation, and the application of newly acquired acknowledge, and skills upon course completion. Consideration of other active initiatives, stakeholder perceptions, accessible resources, communications, and unit workflow assists in the maintenance of an environment conducive to workforce participation with strategic initiatives and collaborative practice. Incorporating terminal symptom management into professional development provides advantages to both the organization and its patients. The introduction of a strategic plan informing stakeholders of the most vital components to implementing changes has been presented. Obstacles will present along the way. However, effective leadership, teamwork, and the use of proven theories and models will lead to success.